Hi, welcome to Stewart Middle School's COVID-19 school exclusion recommendations. This will be covering all things COVID. This is brought to you by the nurse's office as well as the safety committee. COVID-19 school exclusion recommendations. Two of the following symptoms: fever, measured or subjective, chills, fatigue, myalgia, headache, sore throat, congestion, nausea, vomiting, or diarrhea, or one of the following symptoms: a cough, shortness of breath, difficulty breathing, or new loss of taste or smell. The individual, should they present those symptoms, should be tested for COVID 19. If the result is negative or the doctor's note with the differential diagnosis, return to school after 24 hours after febrile or afebrile and improved respiratory symptoms. If the test result is positive or individual is unable or refuses to get tested, they may return to school after 24 hours with no fever and improvement in symptoms and 10 days since the symptoms first appeared. Positive COVID 19 PCR or antigen point of care test with symptoms may return to school after 24 hours with no fever and improvement in symptoms and 10 days since the symptoms first appeared. Without symptoms, may return to school after 10 days after specimen was collected. If symptoms develop during the 10 days, follow return to school guidance for positive PCR or antigen test with symptoms. Close contact to a positive within 6 feet for 15 minutes or more, or someone in the same household has it or is diagnosed. Household contact. If testing resources are sufficient, close contacts should be tested regardless of symptoms. With symptoms, the individual should be tested for COVID 19. They may return to school after 24 hours with no fever and improvement in symptoms and 10 days since symptoms first appeared. Without symptoms, quarantine can end 10 days after exposure without testing or after 7 days with a negative PCR antigen test, and it must be collected on day 5 or thereafter. Household contacts may require further investigation by other OPH or school officials to determine the dates of quarantine. The most protective recommended quarantine remains 14 days post exposure to COVID 19. It is recommended that system monitoring continue until day 14. If symptoms develop during the 14 days, follow return to school guidance for close contact with symptoms. COVID vaccination. This is the last block here on the lower right. People who are vaccinated against COVID 19 do not need to quarantine after an exposure to another person with COVID 19 if they meet all of the following criteria. They are fully vaccinated, for example, greater than 2 weeks following the receipt of the second dose in a 2-dose series, or greater than weeks following receipt of 1 dose of a single dose vaccine. They are they are within 3 months following receipt of the last dose in the series, and they have remained asymptomatic since the current COVID 19 exposure. Proper mask wearing. For the mask to be the most effective, it must fit as snugly as possible to the face, covering the chin, mouth, and nose up to the nose bridge. The mask should not be below the nose or worn at the tip of their nose. Here's how to wear a face mask properly. Notice the poor examples on the left and the positive examples on the right, facing front and in profile. Mask up. Masks must cover the nose and mouth at all times. Students will be told to mask up to reinforce proper mask wearing. Masks must be worn when traveling within the building, and masks may be removed when eating breakfast and lunch. Only those times. Why? Well, reducing the risk of transmitting COVID 19, of course. Notice from left to right the high risk of transmission, close contact without masks. Now notice moderate risk of transmission with close contact with only one person that's masked. And then there's a low risk of transmission when there's close contact with both persons masked. The low risk of transmission is what we are striving for here. Hand washing. Hands will be washed after bathroom use. Hand sanitizer will be used upon entry into the classroom. Follow these 5 steps every time. Wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with soap. Scrub your hands for at least 20 seconds. Rinse your hands well under clean running water and dry your hands with either paper towel or air dry. Social distancing. Staff and students will maintain 6 feet distance. Students will walk single file while traveling in the hallway to lunch or any reason while in the building. COVID-19. Everyone needs to do their part to make sure everyone stays safe and healthy. Following proper procedures when entering the building, walking in the building or outside, and in the classroom, and even in the cafeteria. Thank you so much for your time and attention.